But the other thing that has been approved now for about a year and a half, a little over a year and a half, I believe, it's a medicine that we have actually used for over 20 years to treat allergic asthma. And it's called Omalizumab. That is the generic. The brand is Xolair. Just recently, a biosimilar was released. And biosimilar is basically the word for generic with biologic medications. And Xolair is a medicine that it binds to that IgE protein that is in our blood that's specific for things you are allergic to. So, for instance, peanut that we've talked about a lot. And it helps that to be taken up in the blood and occupied so it's not sitting on the receptors of the mast cells that hold histamine. And over time, those receptors, because there's not enough IgE sort of sitting on them, they downregulate, which means you have less of them. And when you then have an accidental exposure to the food, there are less receptors on those cells to activate because there's not IgE specific for the food sitting in them. So the practicality of all that basically just means that it is a shot and it's given once every 2 to 4 weeks. And that is based on what your total IgE level is and your weight. And then age is taken into consideration as well with that. So the idea is that when you use this medication for food allergy, it is to try to get you to where if you have an accidental exposure, you have an increased level of tolerance than what you normally would whenever you are not on Xolair. So if you have an accidental bite of something, you are more likely to tolerate it. The initial, I'm not sure if initial is the right word, but a lot of the recent studies with Xolair were done actually on people who are undergoing oral immunotherapy. So it doesn't preclude you. That's what my patients say is it doesn't preclude you from doing OIT or SLIT. You can do that with it. And I have a lot of patients who have chosen and wanted to do that. The advantage is it also can help with chronic hives and asthma as well. And a lot of people honestly sinus disease.
Yeah.
Exactly, polyps. Yeah. And it's a very helpful medication for people who are atopic, meaning very allergic to things. And it's something that is in the repertoire of all those foods. I feel like, or all those things for foods. I feel like we're still in the forefront of learning about all of this. And there's new things that I see pop up in my feed all the time on Doximity about food allergy and things coming up in the future.